So we have the infraorbital nerve here. Create a window. The posterior border is around here. And then we will create a window, something like this. There is a membrane inside, so try your best to keep the membrane intact. But I may demonstrate complications, so if I perforate, you don't be surprised, because I am showing you what is complication. We don't have water irrigation when we are working on model, but we have air spray. Help us to remove the debris. So we try to keep but as I said, it is actually easier to use the normal drill for implant. So make sure that the membrane is away from the drill. Okay, you see the drill coming out. Now we can large enough for you to put the round burr in freely. So it makes our life easier. And then the round burr will go along the posterior wall until it engages the base of the zygoma bone. Okay, then we start the drilling to make the mark inside the zygoma bone. Okay. We don't need to. And again, it's easy because this hole is 3.6. So I engage the two holes before I activate. Then the drill actually won't wobbling. You see, I'm coming out here. And I look at the mark on the drill. This one is 50, this one is 45, this one is 40. And since the dummy is 40, let's see. 40 is more or less okay, because already we see the drill tip here. Sure that whether 40 millimeter is okay, you can use this depth gauge to look at it. Usually, this is the face of the patient, and I always palpate with one of my finger. So I actually can feel this is protruding, and then I just push it back a little bit, make sure that it is flat with the hole, and then I look at the mark, it is 40. So it's very good for the dummy. And then we are going to install it. By doing this, I know what is the actual sitting top of the implant. So now it's 50. Okay, this actually we can use the manual one. But as I said, when we place the implant so far backward, this one most of the time cannot be used. Because for the final turn, we want to have very fine control, because we want to make sure that the implant head get the correct orientation. So we want to have the screw access hole. So there is a screw here corresponding to the future position of the prosthetic screw. So we want it to be vertical with respect to the occlusal plane. Something like this. Almost. Okay, it is vertical. And this is the position I want. But of course, sometimes, so then we can loosen it. Most of the time cannot be done 50 Newton centimeter. 得唔怕，得唔怕唔怕。So we unscrew the friction mount. Then you see the